I'm Scott Munn along with Tug Cowart in the Warrior Alliance Network studios in Atlanta, Georgia. Do you know a veteran who's battling PTSD or a brain injury? Today we'll talk with a neurologist specializing in traumatic brain injury, or TBI, who focuses on helping athletes, service members, and veterans. The spotlight is on the Shepherd Center and the Avalon Action Alliance as we're joined by an Air Force veteran who's a talented doctor and leader at both of these important organizations. Dr. Rusty Gore is the founding director of the Complex Concussion Clinic at the Shepherd Center, where he also serves as medical director for the SHARE military initiative. Dr. Gore is also the chief medical officer for the Avalon Action Alliance and a professor of biomedical engineering at Georgia Tech. Tug and I are honored to have him join us in the spotlight today. Dr. Rusty Gore, welcome to the Warrior Alliance Network.
Thanks. It's an honor to be here. Appreciate it.
Sure is a pleasure to have someone of your level of expertise. And, being here at the ballpark, sports is obviously something that gets talked about a lot, and I think that's where a lot of people learned about concussions, even more than our military men and women. The NFL concussion thing, you have people in baseball that run into it. You're at the forefront of the nation's advanced research on concussions and traumatic brain injury. What's the latest? I mean, what's the information that folks need to know and how the brain is affected by repeated head impacts, blast forces, sports, even with kids? I mean, there's a real reason to understand concussions.
Yeah, absolutely. I appreciate us kicking things off with that question because it's a really fast-moving field. The way that we're recognizing these injuries, the way that we're managing these injuries has really shifted in the past year even. I'm giving talks. I gave a talk 2 weekends ago to a group of neurologists in the state of Georgia, and I was telling them these are the latest updates in how we should manage this injury, and it is different than the talk I gave a year ago. It's a really fast-moving field. So, in terms of the big picture, hot topics right now, when we think about these injuries, we're really interested in the effects, not just of injuries where you might have symptoms. So you might call that a concussion. We would say a clinical concussion. It's the sexy moment in the stadium when the crowd goes, ooh, because there's a big hit and then somebody has an injury. Those are obviously really important injuries. What we're much more concerned about right now, and what we're learning more about, is the effect of forces applied to the head over and over again. So football impacts that you're sustaining for high school, college athletes, 400 to 600 hits to the head, greater than 20 Gs per season.
Goodness.
Veterans and service members that are in just training environments, and they're sustaining dozens and dozens and hundreds over time, blast exposures within close proximity. So we're trying to better understand that group so that we can ensure that their potential injuries are recognized, and we can have a preventative stance to even try to minimize how those exposures are delivered.
Goodness, there's so much there. I could ask 10,000 questions about just that. With especially athletics, people in the military, yes, but their own kids too, playing ball, playing football, and it's important that way too. But do you see cases where veterans have PTSD symptoms, but the cause of the medical condition is TBI?
We do, absolutely. And I think this is, it's important to recognize that post-traumatic stress, traumatic brain injury, mood-related issues like depression, and challenges with substance use, they tend to come together in a package. So not everybody has all of that, but there's a lot of overlapping in terms of symptoms. And when we think about what led someone to that place, we think about traumas in the psychological sense when we talk about post-traumatic stress, but the reality is that folks are often simultaneously either sustaining traumatic brain injuries through the big booms, or they're having repetitive exposure, as I mentioned before. So we know that among those who diagnosed with post-traumatic stress, about 60% also have a mild traumatic brain injury in the veteran community. And when this individual might show up in your office or might be at a dinner party and you're seeing them in the community, at the bar, whatever you are, they have symptoms that might overlap between those. But we often gravitate immediately towards the post-traumatic stress piece. If they don't like to be in crowds, if they maybe are nervous about loud noises, those are actually symptoms that can also, we also see in individuals with traumatic brain injury.
Wow.
So that overlap makes it a real challenge.
It seems like TBI is sort of misunderstood amongst the public. So can you kind of clear it up a little bit in that what is your procedure to make a TBI determination once they come in if they decide they want to visit?
Sure. So I think, when we think about traumatic brain injury and trying to diagnose and identify the injury, first we need to make sure that somebody's actually had an exposure that makes sense. At times I'll talk with individuals who might be concerned about having a traumatic brain injury, but the forces involved with whatever collision maybe or whatever bump they had, it just doesn't make a lot of sense. So there's a lot of education there about what constitutes a potential injury. That's sort of number one. Then we start to think about, really we focus on function. So the brain is organized into different networks. Those networks subserve things like, can you balance? Can you track an object with your eyes? If we think about an athlete, like this is what an athlete's doing, right? They're really rapidly adapting to a dynamic movement environment, and they're balancing, they're tracking with their eyes, they're making split-second decisions cognitively about what they need to do. So the brain has networks that control all of those different functions. And if an individual has a mild traumatic brain injury, those networks are disrupted. But those networks are disrupted in a different way for everybody. It's a very variable injury. Who knows where your networks may be affected? So what we do when we're trying to diagnose this injury is we cast a wide net. We're looking at how are you functioning cognitively. Not just how is your memory on a written test. How's your memory when we put you in a distracting environment? Maybe your function drops then, which is important depending on what you're trying to do in your life. How are you tracking objects with your eyes? How is your balance? And then there is a network in the brain that controls emotional regulation. It's called the limbic system. It's as real and organic as the network that controls eye movements. And so folks with brain injuries have emotional dysregulation because that network can be involved. And so we look across functionally all of those domains, and then there are criteria for establishing there was an injury or an exposure that might have led to a TBI. We're seeing functional deficits that fit with TBI. And I think to highlight, a lot of folks go to the doctor and they say, I think I might have had a traumatic brain injury. I need an MRI. That's a great example. Unfortunately, imaging right now, about 96% of individuals with a known mild traumatic brain injury will have normal imaging. And so imaging in the acute phase can be important because we can be looking for blood and other predictors that maybe the injury is more than a mild TBI. But once someone's having symptoms and they're coming to our office, really imaging does not diagnose this condition. It really need to focus on how are you functioning.
Yeah, and I think you're doing a great work on helping veterans with that at the Shepherd Center. Folks, if you're out there listening and you have any of these kind of symptoms, or you're married to someone who's a veteran who has this kind of symptom, go to shepherd.org, shepherd.org, and that's where you can get a hold of Dr. Rusty Gore and his great team over there, and tell us a little bit about what you're doing at the Shepherd Center. Tell us all about the Share Military Initiative.
Sure. So the Share Military Initiative is an interdisciplinary rehabilitation program. So what that means is that we put all of the folks, all of the diagnostic tools, all of the clinicians and specialists that you may need to address a traumatic brain injury all under one roof. So everyone's in the same building. And so interdisciplinary means that our teams of therapists are working side by side, day in and day out. So clients that are being in treatment with us, they all often comment, I was just with one therapist and I was telling them today I've got a headache or I'm having this issue, and we were working through it. We were doing some therapy. I then went to the next therapist. They already knew what I was dealing with that day. They didn't have to repeat themselves over and over again.
Communication is good.
Yeah. So the team is they're working as a team. It's just like a sports team. We're not an individual sport. We're a team sport. And so that's really a game changer when folks have complicated conditions where we've got to look across all those domains we just talked about, and we're trying to treat the whole person. So we bring all of those resources under one roof. service members, veterans, and first responders who have a history of a traumatic brain injury, you may not be sure if you have a TBI history. We want you to call us and come because that's part of the assessment, and we're going to treat you.
And one thing I've noticed over the years is that at Share, sometimes you'll bring the family to stay with the individuals getting treatment, and they'll be there in a hotel right next, staying with them, and that's part of the system, isn't it?
Absolutely, it is. So we actually have clients that come from the whole nation. So every state, we bring folks in. We cover all the costs to bring folks in and treatment as at no cost to the veteran or service member. We absolutely bring families as well. Families will spend time with us. A lot of our veterans have spouses that are tremendously important and supportive, but one of their goals is that they want to be more independent. And so sometimes we actually have them at the program without their spouse for a period of time because that's their goal, is to try to be more independent. And then we incorporate home visits. We incorporate their spouse into their care. And that's kind of a unique thing about Shepherd as a whole. The Shepherd Center, when an individual is in treatment for more severe TBI, spinal cord injury, we're providing housing for their loved one on site. We just built a new building that's going to facilitate even more of that flexibility. And I've been fortunate not to have to deal with this in my own family, but I can only imagine that coming in that kind of a situation, it's a real benefit to be able to have a comfortable place to stay and not worry about housing while your loved one is in treatment.
Do you have a good example? Can you give us a great story about someone who's gone through that program and become more independent and doing things on their own, and then they're healing at the same time? Can you share something like that?
Yeah, I can. I actually one of the gentlemen that I treated in my first 2 years, I believe, after coming to the Shepherd Center. I've been at Shepherd I'm in my 10th year. His first name was Jonathan, and this was a guy that when you looked at him, so he was a former Marine. He carried the 60 in the Marines in the mountains of Afghanistan. So this is the guy. I'm not sure if he played college football, but he easily could have been a Division I linebacker. And he had all the right tattoos. If this individual walked into Costco on a Saturday, you would think this guy is in control of the world, right? This is someone I'm not going to mess with. This is also somebody that is in control of his world. So, he's a badass.
He was a Marine. He's a Marine. He's squared away.
And looked good coming off the bus.
And he still looks that way, right? And so he came to our treatment program. He'd had a number of blast injuries during his military service. He had served for, I believe it was in the just past 10 years of service, and then was medically discharged because of symptoms related to his service. And he was struggling. And one of the things we do when folks come to our program is we have them set their own goals. We say, okay, what goals do you want us to try to achieve? I shouldn't be setting your goals, right? And those goals can be family, they can be fitness, they can be work, they can be whatever you are trying to get out of treatment. And he came to the office and he told me that his goal was that he wanted to go to his daughter's elementary class and have lunch.
Oh, wow.
That was his goal. He was like, I can't do that. There's too much going on.
It's overwhelming.
I'm going to have symptoms. I couldn't go to an elementary school in the middle of the day and sit down and have lunch with my daughter. So that was his goal.
That's heartbreaking.
It is heartbreaking. And I had a daughter that was exactly that age, the same age as his daughter at the time. And honestly, I get a little choked up every time I tell this story because it really hit. It hit me in a real personal way.
Yeah.
And if you looked at this person on the street, that's what we call this a silent injury. You would have no idea that he was struggling in this way. And of course, he couldn't do that. There were a whole lot of other things in his life that he was struggling to do.
Oh, I can only imagine.
But his goal was that he wanted to be able to go and have lunch with his daughter. And so our treatment team, that's what we do. Every single treatment that we were doing across our whole team was focused on trying to help him achieve that goal. And actually, about halfway through treatment, it took about 6 weeks into treatment, he had a home visit, and he went home, and when he came back, he was like, I did it.
That's awesome.
I had lunch with my daughter. And then he said, I need to set a more ambitious goal.
Goodness.
And so then we set another goal, and he kept on in treatment, and he's done really well. But I think he's just a really good illustration
Oh my gosh, yeah.
of what we've got out there. These are not individuals that are visibly injured within our community. A lot of the veterans who need this kind of care and who would benefit from it are high performers. They are not all struggling and unable to leave their basement or under a bridge, right? There's so much need in those spaces as well. But there are a lot of high performers like this gentleman who need this kind of treatment, and it can be game changing. And they often don't realize that traumatic brain injury is one of the reasons that they need it, and often they're not getting the care that they need through sort of our normal healthcare channels for veterans.
I'm glad you shared that story, because that one is eye-opening to me, and I think it will be for everyone listening right now too. So tell us about your role as the Chief Medical Officer of the Avalon Action Alliance.
So the Shepherd Center Share Military Initiative that we just talked about, we are a member of the Avalon Action Alliance.
Okay.
So the Avalon Action Alliance is a network of treatment programs nationally. We have 6 treatment programs, and they are all similar to what I just described. So interdisciplinary rehabilitation, folks come for an assessment that's up to a week, where we're able to look to see what your primary issues are. Do you have a brain injury? Do you not? Would you benefit from treatment? What are some things that we can do to support you? If after that assessment that we're making a recommendation for further treatment, then they come back to the center and they go through a 3-week intensive treatment program. There are more than 100 clinical visits that occur during that 3 weeks. I would argue in the sort of normal healthcare for brain injury within the VA and in the civilian world, in order to get the same level of care, it would take 12 to 18 months, and the clinicians aren't talking to each other, and it's all spread out. So it's called an intensive outpatient program, because we bring you into this program for intensive care. And so the Avalon Action Alliance supports that mission.
Okay.
And then we also have a non-clinical arm that is run by Boulder Crest, which focuses on post-traumatic stress symptoms, and it's called the Warrior Path. And they do an amazing job putting groups together for a week-long retreat, and then you follow with your cohort for 6 months after the retreat. And it is, especially for veterans that are struggling and are reluctant to enter the healthcare system, it's a really amazing opportunity for folks to figure out how to kind of translate their traumas into actual strength that they can use to succeed in life.
Wow.
Amazing stuff.
Impressive.
Fantastic work. We're talking with Dr. Rusty Gore of the Shepherd Center and Avalon Action Alliance. You can connect at shepherd.org or avalonactionalliance.org. And as always, with all our guests, you can always connect at thewarrioralliance.org. That's thewarrioralliance.org. Before starting his career in neurology, Dr. Gore served for 8 years as a flight surgeon in the U.S. Air Force, supporting F-15 operations and combat air evacuation, and experiencing firsthand the immediate trauma and the basically devastating aftermath of combat injuries. We just want to thank you for your service to our country. We really appreciate you doing that for us.
Thanks to you guys as well.
It's a blessing.
I'm among brothers here.
Well, but we're fortunate to have someone like you, and you witnessed trauma on the battlefield, impact of pilot fatigue and head injuries on aviators. Do you see pilots coming in for diagnosis and support a lot?
We have a small group of aviators that we've treated over the past couple of years related to the Navy, predominantly the Navy F-18 program. Has some challenges in terms of their pressurization system, and they've had a actually not an insignificant group of aviators that get to mid to late career and start to notice symptoms that look a whole lot like mild traumatic brain injury. And many of them, it's not clear. A lot of, I've taken care of folks that played football at the Naval Academy, and then they flew the F-18 and they ended up in my office, and we're trying to figure out, is this repetitive exposure that's pre-service? For folks that might be listening that are familiar with high-performance aircraft, we're pulling a lot of G's and we're doing a lot of it. The pressurization system in these aircraft can sometimes be finicky and unreliable. and you can have rapid decompressions that can occur, which have a potential effect in terms of your brain. And so really the jury is out. It's the Navy. Some media recently. The Navy has a large study that is going on right now to try to better understand the effect on high-performance aviators. So that accounts for a really small percentage of folks that I've treated at Shepherd, but because of my background in high-performance aviation and this being my specialty, I've had the opportunity to work on a team with the Navy to try to better understand this injury.
Yes, sir. The experience as a combat flight surgeon, did that impact your decision to pursue a career dedicated to helping veterans after your service?
It definitely informed that decision. I always talk, most of the great decisions I've made in my life, including everything from my career to real estate, have been just complete luck, and I stumbled into something that turned out to be awesome. And so, when I went into the Air Force as a general medical officer, so I didn't have a specialty, and I was really captivated working in that environment by high-performing individuals trying to succeed in a very challenging environment. Dynamic movement. You got to think fast. These are professional athletes flying, hundreds of $1 million aircraft, right? So I really enjoyed that performance component. And when I left my military service, I made the decision to specialize in neurology because I wanted to better understand the neurologic reasons why folks can perform or they can't. After all of that training, I ended up in a traumatic brain injury fellowship, and it was a natural fit for me. I really wanted to care for folks who were high performers, and mild traumatic brain injury is a major issue across a lot of those populations. And the book League of Denial that highlighted the issues going on in the NFL.
Yes, sir.
It was published in 2013, and within 6 months I started my TBI fellowship. So I think that there was an influence of alignment in terms of what was happening in the world.
Dr. Gore, speaking of the NFL, I know you serve as a concussion and TBI consultant and advisor for national athletic organizations like the NFL, college, professional sports teams, the VA, and even the DOD. So I guess you're kind of uniquely qualified to explain the difference or similarities between sports-related concussions and veteran brain injuries. Are they different? Is it two different things, or is it all the same?
So, really, when we look at the pathology and what we think is happening at the cellular level in terms of the brains of individuals that are sustaining these injuries and exposures, there's a lot of similarity. There's certainly a difference between a blast wave transiting through brain tissue and someone having a blunt force impact to their head. But what we see is that the pathology can be in maybe different locations. It looks slightly different, but it really is creating this microscopic neuroinflammation that's happening within structures in the brain that allow those networks to work efficiently. And over time, it has an effect if you receive repetitive exposure to impacts, but also even just an individual injury has some effect. A vast majority of folks, there's a lot of healing going on. This isn't a doomsday situation where everyone needs to go and stop playing sports and we need to, I think that's important, but I do think that the injuries, they are a lot of similarities. They're also happening to people who have a very similar physiology and background. It's not normal to enter military service, if you aren't in some way relatively athletic, right? If you don't have a mentality of performance and you want to challenge and you want to tackle, what is in front of you. And so we get this group of individuals that are serving the military and that tend to succeed in athletics that look similar in terms of both their mentality, their physiology, their goals. And
just what they're drawn to.
Just what they're drawn to. And then there's sustaining injuries that have some differences. But I think overall, we're focused on function. We're focused on getting folks back to performing in their world the way that they want to for their family, for their job, whatever it may be. And because of that, we can take these sort of different populations, and in the end, our organization is really applying a treatment that's similar, and we see really good results.
So the Shepherd Center's Share Military Initiative is now a community partner with the Warrior Alliance. And how does that partnership support your work? And what would you say to a veteran listening right now who might be struggling with mental health?
Yep. So I think it's important to highlight that when we're talking about brain injury, we mentioned before, brain injury, post-traumatic stress, depression, substance use. Now, those are all clinical diagnoses, and that's, I'm a physician, so I put my clinical hat on. None of these issues happen in a vacuum. Folks are living in the real world. Folks have real-world stressors. Folks have financial needs. They're looking for employment. They're looking for opportunities to make meaningful connections with other folks that understand what they've been through in their journey. So that maybe they're looking for veteran connections, maybe not, whatever it may be. And a lot of folks out there are hungry for information. So what I found is our partnership with the Warrior Alliance really gives us an opportunity to leverage their work in terms of legal support, for example. Imagine if you are managing to compensate and you are living this house of cards where those issues are a part of your life, but you're still keeping your job and you're still trying to manage your family.
But then one thing happens.
Yeah, it is the straw that breaks the camel's back. Right. Somebody has, the legal issues. Somebody separates from the military and loses their support network. And so we've got to have resources like the Warrior Alliance that are able to connect them with those services. And they're connecting a lot of veterans with our services as well. But it's not just about clinical world. It's about real world. And I think that's where this partnership is valuable.
And that's why it was so important to have you on today. And I hope you'll come back again. There's 1,000 more questions we could ask. We just barely brushed the surface of the things that I could ask you just off the top of my head. So I hope it won't be the last time we get to see you, Dr.
I'd love to see you guys again. This is great.
Yes, sir. Absolutely.
Thanks for everything you're doing. Thanks for your service to our country. And thanks for your continued service to our veterans.
Absolutely. I appreciate it. Thank you.